Welcome back. We are learning more about some unusual symptoms of coronavirus.
Patients around the world are now reporting a loss of sense of smell and taste. And joining us now via Skype in Northridge is Dr. Marc Kerner. He's an ear, nose, and throat surgeon with Dignity Health Northridge Hospital. Good to see you.
Great. Good to see both of you.
So let's talk about this. What are doctors learning about these new symptoms, smell and taste?
Sure. So we're on a chat group with otolaryngologists all across the country and all across the world. And what we're hearing from our colleagues, primarily in South Korea, but also from Iran and actually from China, is that a number of patients have presented with a loss of smell and just a runny nose as part of their COVID-19 presentation.
Do you know what's causing this?
Well, yeah, we pretty much know there's a number of viruses that cause loss of smell. Sometimes if you can recall, when you have a cold as a child, sometimes you'll end up having loss of smell for a few days or even a week while you have that cold. So there are cold viruses that are in the coronavirus family that are cousins to this COVID-19. And then there's also a number of other viruses like rhinoviruses, which can cause colds and loss of smell as well. And typically it's going to be something that's self-limited, that once it resolves, the sense of smell will resolve as well.
And so when are they seeing these symptoms appear? In the beginning?
Well, that's typically how they'll present. That may be the only symptom that they have. So that's what they're seeing in other parts of the world right now. And a study that was just completed in South Korea showed 15% of their patients presented just with loss of smell and a slight runny nose.
Is this temporary?
Well, yes, we believe it is. I mean, we don't know exactly with COVID-19 yet because it's too soon. But in other viral causes of loss of smell and loss of taste, they do tend to resolve, but it can take months sometimes.
So if someone does lose this sense or both of these senses, are they supposed to get tested for COVID-19 at that point?
Well, right now in this country, it's not one of the criteria to be tested. However, we are testing patients if they do come in with loss of smell. We've had 3 patients who didn't meet criteria for any of the other symptoms. They didn't have a cough. They didn't have a fever. So we really couldn't. They don't meet the criteria. So at this point, as we start to get more widespread testing, I'm advocating that people that do present with these symptoms should be tested as well.
Yeah.
All right. Well, Dr. Kerner, thank you for the information. That's interesting. Loss of smell and taste.
Really interesting. All right. Thank you. We appreciate it.
Great. Thanks, guys.
Not something you want permanently, that's for sure.
No, that would be horrible. Let's